Greetings. So let us learn about the role of various hemostatic devices used during gastrointestinal endoscopy. So in this session, we will talk about through the scope clips. These are my acknowledgements, and today's learning objectives include the following. We will learn about the various uses of through the scope clips in GI endoscopy, and also how to handle a clip device and how to use it properly. One of the most common reasons for the use of a clip is to control bleeding, as you can see in this video. This is how a clip device looks like. The handle looks similar to other devices we've talked about, and the end has that opening and closing clip. Clips have been used for a lot of different purposes. Most frequently, clip is used to control bleeding, and it is also used to close defects to prevent delayed bleeding, and also close defects with a deep injury to prevent a perforation, as well as close perforations of the gut. So these are the two most common reasons that clips are used. In addition, people have explored the role of clips in other situations, like binding a stent to prevent it from migrating down. And nowadays we have better clips that go over the scope, which have been shown to have a much more lasting effect than the through the scope clips. And through the scope clips have also been used to fix a feeding tube to the gut to prevent the feeding tube from coming back into the stomach. This is especially true when it comes to a jejunal extension that goes through a PEG tube. For those who do colonic manometry, the manometry catheter could be bound to the colon using a clip. So in other words, a clip can be used to anchor a particular device to the gut wall. It is also used as a marker to help a radiotherapist find out where the tumor is and focus the radiation to that area. A surgeon to find out where the tumor is. If you see a cancer and you don't know where exactly it is in its location between the cecum and rectum, in addition to putting a tattoo to define the site, sometimes it helps to place a clip and take an X-ray, and that X-ray will be helpful to the laparoscopic surgeon to figure out where exactly that tumor is located. Sometimes we try to control bleeding and we are not successful in controlling bleeding, and in that case it's a good idea to deploy a clip close to the bleeding site, and this helps the interventional radiologists figure out which vessel to aim for when they're trying to control the bleeding using interventional radiology and embolization procedures. So we've talked about the various uses of clips. These include control of bleeding, closing defects, anchoring different types of tubes, and marking the sites for interventional radiologists or radiotherapists to deliver their therapy. So now let us move on to learn about how to operate a clip as an endoscopy technician. So when the clip device comes out of the envelope, it is in a closed position, and you handle the clip device similar to other devices that have the handle with a ring to insert the thumb and a sliding bar for the forefinger and a middle finger to slide the sliding bar forwards or backwards. And the sliding bar moving forwards will open the clip. In other words, opening the grip opens the clip, and closing the grip closes the clip. So let us look at that. Now, in this image, you see it is in a closed grip position and the clip is in a closed position. When you open the grip, the clip opens. When you close the grip, the clip closes. Most of the current devices have this ability to reopen and close at least 2 or 3 times so as to help the endoscopist change the way he is going to apply a clip. And once it's in a closed position, if you close it further, it will allow the clip to deploy. So we've learned about how to open, how to close, and deploy. So it's important for the endoscopist to say, open the clip, and the assistant opens the hand and opens the clip. And the endoscopy assistant says, close the clip. And during that time, the assistant should close the clip slowly so as to allow the endoscopist to make adjustments to have a better approximation. We will talk about this a little bit later, what I mean by this. And then when the endoscopist says deploy, then only the endoscopy assistant should deploy the clip. So open, close, and deploy. It is a 3-step process. So let us look at why it is important for the endoscopy assistant to close the clip slowly. Let us look at that. So here is a clip trying to close the defect, and the clip was closed and deployed. And as you can see here, there is a gap between the 2 blades of the clip, and the clip approximated only halfway its length of the blades. So these types of clips will not be effective in performing their function. They get loosened, and the defect could reopen, and the patient may rebleed. The goal of clip closure is a deep approximation so that you don't see any of that gap in between the 2 blades of the clip. And let us learn how to go about doing it. So you have the line at the end of the clip, and as the clip closes, it retracts back by a few millimeters. And one has to compensate that retraction movement by either forward movement of the scope or gently pushing the clip forward by a few millimeters as the assistant is closing the clip slowly to allow the endoscopist to make that small adjustment so that the endoscopist could achieve a deep approximation of the defect. So you can see here, this clip closure is perfect. We achieved a deep closure. The entire length of the blades were approximating, they adjust together. There is no gap in between the 2 blades like we have seen in the earlier slides. So in summary, we have learned about the role of clips primarily used for hemostasis, also used for closure of defects and perforations, and also in some circumstances to bind various devices to the gut, either a stent or a feeding tube or a manometric catheter, and also to help radiotherapists focus the radiation beam and interventional radiologists to deliver the therapy, or the surgeon to figure out where to put the ports by marking the site of the tumors and also the site of the bleeding site. We've learned about the 3 steps in clip application: open, close, deploy. As an assistant, when you close the clip, close it slowly to allow the endoscopist to make that adjustment for a deep approximation of the edges of the defect and a better closure. Hope this is useful. Thank you.